Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to be talking about what you can expect in nursing school clinicals. So I started nursing school during my junior year of college, and on one hand I was so excited because I'm the type of person I like to work with my hands. That's really how I learn. So being in lecture class, it can be a little bit tedious for me because I want to be working and learning. And plus, another thing I was really excited about was working with other nurses and seeing what they do in real life, having real patients, real orders coming in that they have to do. So that was one thing I was really excited about. On the other hand, I'm really nervous because here I am going to this large hospital. I'm not really familiar with the floors and where everything's located. And I'm asking myself, am I going to get lost? Am I going to be able to navigate my way through this huge hospital? Or am I going to go in an area that I'm not allowed to be in or something like that? In addition, I was nervous about fitting in with the others on the unit. Like, are the other nurses going to like me? Or am I going to make a mistake that I'm not allowed to do as a student, like a big blunder? So on one hand, I was really excited, but I was also nervous. So how my nursing school program was set up was that our clinicals were based on whatever classes we were taking that semester. So if you were taking peds or OB, your clinicals that semester would be with those classes. And it would vary how many days a week we would be there at the clinical site versus the hours. It was never the same. And one great thing about my nursing school program was that they let us sample a lot of fields of nursing. Like, we were everywhere, from being in a clinic to being in wound care, home health, the ICU, the ER, the OR, Med-Surg floor. We got to be in it all, which was great because it showed me what I wanted to do in nursing versus what I didn't want to do in nursing. Now, how your clinicals are structured really will depend on your clinical site. And I'll just share some of my experience with you. Whenever I was doing like my Med-Surg clinicals, what we would have to do is we would have to go to the clinical setting that night before and collect information on our patient, look through their chart, and then take all that information and develop a care plan that night. Then all the students I was with at that particular clinical setting, we would arrive, we each had our own patient, and we would implement that care plan that we did the night before on that patient. And our clinical instructor would be supervising us, watching us, making sure we were doing everything right. So we would be responsible for all the duties of what the CNA would do, collecting vitals, baths, linen changes, everything like that, in addition to doing orders, the full body assessment, charting. So that's what we would do during that clinical. In contrast, for my OB clinicals, there was a group of us students and we were under a clinical instructor, and that instructor would divide us up into about groups of 2 or 3, and we would be assigned either to like the newborn nursery with all the little babies that were just born, or we would be on the floor helping to assist with all the births. And that was actually one of my favorite parts because that is where I got to see my first vaginal delivery, and it was just really awesome to watch and see what they do with that baby once it's born and everything like that. And then another group would be like in the OR watching OB type surgery procedures. And then another group would be with the postpartum women who just had their babies. And at this particular facility, it wasn't all grouped together like how it is in a lot of places. Whenever a woman hit the postpartum part, they would be on a different unit of the hospital. So being in that clinical, it was really awesome because you got to experience the nursery, the birthing, the surgeries, and postpartum throughout your clinical semester. Now, my last semester of nursing school, those clinicals were my absolute favorite because what happened was that previous semester you had to submit your 3 top choices of where you wanted to be for your practicum, because this is what this was. It was like a senior practicum. And my top choice was cardiac nursing, and I wanted to be on a progressive care floor because in my previous clinicals, that's where I was, and that was one of my favorite clinicals. So luckily, I got my first choice. And during that clinical, what I got to do is just me assigned to this particular floor with this registered nurse, and I would work her schedule. So the great thing about that was that I was there from beginning to end. I got to see everything that went on through that shift, because a lot of times when you're in clinicals, you don't get to see that because maybe you're only there for 8, 9 hours. And that's where I got to experience my first code blue situation and just crazy things that pop up during a nurse's shift. You get to see it because, like I said, when you're in clinicals, you really don't get to see a lot of that sometimes. So I really thoroughly enjoyed that. It helped me connect the dots with what I'm learning in class to what is expected from a registered nurse. So that was my experience with clinicals. Now I have a whole video on how to actively participate in clinicals, so if you're about to start clinicals, you might want to check that video out. But let me give you some quick tips on how to get the most out of your clinicals. First of all, what you want to do is you want to make sure that you are conveying to your preceptor and other people around you that you want to learn. Because sometimes as a nursing student, you are just like really thrust into this environment that you're unfamiliar with it, you don't know people, you don't really know what your role is or what you're supposed to do. So you can get nervous and shy and timid. But being that way may convey to others that you really don't want to be there, you're just there to get your clinical time in. And if you really are vocalized, you speak up and you say, hey, if the situation arises, can I start some IVs? Can I use the glucometer to check blood sugars? And whenever a nurse hears that, usually they're like, yes, so you can definitely do that because that helps them out. So make sure that you just try to be as vocal as you can so you can get the best learning experience possible. In addition, at some of your clinical sites, you may come across some nurses who really just don't want a student. There's a lot of different types of nurses out there. There's some nurses who are excellent teachers. They love having students with them, sharing knowledge, but there's other nurses who are just focused on their job. They just want to care for patients and they don't really have the want or desire to teach others. And whenever I was in nursing school at clinicals, I encountered a few who were like that. They just didn't really want a student, looked at it as a nuisance, but majority of the nurses I encountered were great. So if that does happen to you, don't let it get you down, because I have talked with some students and they're like, I was on this floor and the nurses just didn't like us, and it made me question if I even want to be a nurse because why are they just so rude? And you just can't let some people who may just be having a bad day, if you're there maybe that next week, they'd be in a better mood or something like that, to ruin your perspective on nursing, because majority of the people are really great and easy to work with. Okay, so that wraps up this video on what you can possibly expect in nursing school clinicals. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.